What the study says.
Welcome back to the deep dive. Today we are plunging into a topic that, well, it touches so many lives, navigating the often really overwhelming world of quitting, smoking, and vaping too. If you've ever thought about quitting or tried, you know that feeling, right? Just this flood of information.
Oh, absolutely. Different methods, success rates all over the place, loads of advice, some of it conflicting.
It's a lot. It can feel paralyzing, honestly.
Exactly. And when you're trying to make a big change like this, you need clarity, not more noise.
Right. So that's what this deep dive is about. We've gone straight to, well, what we hope is the source of clarity. We're looking at robust, systematic reviews and meta-analyses.
Yeah, these aren't just, single studies here and there. These are big analyses pulling together data from lots of studies, trying to get the most reliable picture.
That's the plan. We're basically going to guide you through these big research summaries, pull out the most important evidence-backed insights.
Right. What does the science really say about what works for quitting smoking? And then also, what about quitting vaping? That's much newer territory.
Our goal is pretty simple. Help you feel properly informed about all these quitting options based on the best evidence we have right now.
Okay, so where should we start? Probably with smoking cessation, right? That's where the most research exists.
Makes sense.
Specifically, let's talk about the pharmacological interventions, the medicines.
The things doctors often recommend, or you might get over the counter. What did these big reviews say about how well they work long-term, say 6 months or more?
Okay, yeah, for long-term quitting, the evidence gives us a pretty clear hierarchy. Varenicline, for instance, it shows the strongest effect compared to a placebo.
Strongest. I'm stronger.
Well, the analysis suggests it makes you nearly 3 times more likely to successfully quit long-term.
Wow. Okay, nearly 3 times. That's a big difference.
It really is. Puts the potential impact into perspective.
Yeah.
Then you've got nicotine replacement therapy, NRT.
The patches, gum, lozenges, that sort of thing.
Exactly. Patches, gum, lozenges, inhalers, sprays. Those are also effective. They make you about 1.8 times more likely to quit compared to placebo.
Okay, still a good jump.
Definitely. And the medication bupropion, it's right up there with NRT. Also about 1.8 times more likely to quit than placebo.
So varenicline is kind of leading, but NRT and bupropion are solid options too.
That's a good summary.
But how do they compare directly, like varenicline versus bupropion?
Okay, head to head. This is where it gets really interesting. When studies compared varenicline and bupropion directly, varenicline came out on top.
It did.
Yeah, it made participants about 1.6 times more likely to quit compared to those using bupropion.
Okay, so there's an edge for varenicline over bupropion. What about varenicline versus NRT?
Right, this is a really key point. Varenicline was found to be pretty comparable, but specifically to combination NRT.
Combination NRT. You mean using more than one type at once?
Exactly that. Like, say, using a patch for a steady nicotine level, and then maybe gum or a lozenge for sudden cravings.
Right, I've heard of that.
And the research shows that using combination NRT is generally more effective than just using one type alone.
Okay.
And that combined approach,
Yeah.
it looks like it's about as effective as varenicline. The evidence didn't show a significant difference between them.
So it's not just if you use NRT, but maybe how you use it. Combining them is powerful.
Precisely.
What about picking between the single types? Like, is a patch better than gum or spray versus lozenge?
The review suggests most single forms are pretty similar, actually. Effectiveness is roughly in the same ballpark.
Okay.
Although there was one little finding. The category that includes things like inhalers, nasal sprays, tablets, and lozenges. It seemed marginally more effective than nicotine gum on its own.
Marginally.
Yeah, about 1.2 times more likely to quit than with gum alone. But like we said, combining different types seems to give the biggest NRT boost.
Got it. Are there other medicines the reviews mentioned? Maybe ones that aren't as common?
Yes, definitely. Cytosine is one.
Yeah.
It's actually plant-based, works a bit like varenicline.
Plant-based. Interesting. How effective?
The findings look quite positive. One review we looked at suggested it could make you almost 4 times more likely to quit than placebo.
4 times. Wow. That's up there with varenicline's effect compared to placebo.
It is. Very promising. And that review also noted no significant adverse events reported, which is good news, though the evidence base is still smaller than for, say, NRT or varenicline.
Okay. Any others?
Yeah. Nortepinephrine, it's actually an older antidepressant that also seems to roughly double your chances of quitting compared to placebo.
Double. Okay.
And clonidine, which is a blood pressure medication, that also showed it increased quitting chances.
But I sense a but.
Well, yeah. The review highlighted that dose-dependent side effects are a pretty big concern with clonidine. Limits how practical it is for many people.
Right, effectiveness isn't the only factor. Safety and side effects are huge. What did the review say overall about safety?
Absolutely crucial. They did look closely at safety data. For NRT, side effects are usually mild, local irritation, skin stuff from patches, maybe nasal irritation from sprays, or mouth stuff from gum or lozenges.
Okay.
And importantly, the reviews looked for serious adverse events, things like heart problems or issues in pregnancy, and they found no evidence of excess risk compared to placebo in the studies they analyzed.
That's reassuring. What about vapopropion? Wasn't there some concern about seizures?
Yes, there's a known small risk. The meta-analysis estimated at about 1 in 1,500 users, which interestingly is lower than some earlier estimates.
Okay.
And the analysis also found no increased risk of serious neuropsychiatric issues like depression or anxiety or cardiovascular problems compared to placebo.
And varenicline, I remember hearing about potential mental health side effects early on.
Right, that was a concern. The most common side effect people report is nausea,
Oh.
often manageable, but it's there. Insomnia and weird dreams can happen too.
Oh.
But crucially, a very large meta-analysis looked specifically at serious adverse events, and it found no difference compared to placebo. That includes neuropsychiatric events or heart problems.
No difference. That's a really key finding given the earlier discussions.
It really is.
Yeah.
It means the large body of evidence synthesized in these reviews supports the idea that for most people, the benefits of varenicline for quitting smoking outweigh the potential risks. The source material mentioned, the FDA conclusion, aligns with this.
And the ones like clonidine.
Yeah, as we said, clonidine has those dose-dependent issues. Another one, mecamylamine, sometimes used with NRT, can cause quite bothersome side effects like drowsiness, constipation, limits its use too.
Were there any treatments the reviews found just didn't work or aren't
Right.
used anymore?
Yes, quite a few actually. Things like anxiolytics, silver acetate, something called nicobrevin. They didn't show clear benefit over placebo. And other drugs that were explored, like dianocline, rimonabant, caranabant, they're either no longer being developed or aren't marketed anymore for various reasons.
And nicotine vaccines.
Not licensed yet as quitting aids when these reviews were done. Still in the research phases, really.
Okay, so let's distill this pharmacological section for you listening. The evidence is really strong for these standard medications helping you quit smoking initially. Varenicline and combination NRT seem to offer the best shot at long-term success.
Right. Followed closely by single NRT types and bipropion.
And some less common options like cytosine and nortriptyline also look promising based on the data.
But always consider the side effects and talk to a doctor or pharmacist.
Absolutely. This gives you a kind of map, right? A map of the tools that have the most solid research behind them.
Understanding those relative strengths, that's a powerful place to start.
Definitely. Okay, let's shift gears beyond the pills and patches. What about other approaches people talk about? Things like acupuncture or mindfulness, hypnotherapy maybe?
Yeah, this is where things get, well, a bit less clear-cut in terms of the evidence. Generally speaking, the research base for these kinds of methods is less developed. Often the certainty of the evidence is lower compared to those medications we just discussed.
So not necessarily saying they don't work.
Exactly. It just means the really robust, large-scale evidence, that high level of certainty, it often isn't there yet in the same way.
Okay, let's take acupuncture first. And related things like acupressure or laser therapy.
Right. So one meta-analysis looks specifically at these interventions compared to sham treatments, like, placebo acupuncture using non-acupuncture points.
Yeah.
And it did find some signals. For standard acupuncture versus sham, there was a statistically significant benefit, but mainly for short-term quitting.
Short term. So people quit right after treatment, but maybe didn't stay quit.
That's the idea. The benefit didn't consistently hold up long-term in the studies included in that specific analysis.
Okay, so maybe a helpful boost initially.
Possibly. One specific technique, continuous auricular stimulation, that's like pressing beads or seeds onto points on the ear, that actually showed a larger effect for short-term quitting compared to sham. But, and it's the big but, the review highlighted some real challenges in interpreting this data.
Like what?
Well, it's really hard to design a convincing sham treatment for something like acupuncture, right?
Yeah, I can see that.
And the studies themselves used different methods, different acupuncture points.
Hmm.
There was a lot of variation between them.
Which makes it hard to combine the results reliably, what researchers call heterogeneity.
Exactly that, high heterogeneity.
Yeah.
Because of these issues, the sham problem, the variation in the review, actually noted its conclusions differed from some other analyses out there.
Yeah.
So the certainty of the evidence, especially for long-term effects, is considered, well, lower than for the pharmacotherapies. Signals, yes. Clear, high-certainty evidence. Less so.
Got it. Less certain. What about mindfulness-based stuff? Things like mindfulness training, ACT acceptance and commitment therapy, or maybe yoga, distress tolerance strategies.
Okay, so the systematic review focusing on these types of interventions for smoking cessation, it reached a pretty clear overall conclusion.
Which was?
Based on the studies available then, they did not detect a clear benefit for increasing smoking quit rates.
No clear benefit. Compared to what, exactly?
Good question. Not compared to other treatments of similar intensity, not compared to less intensive treatments, and not even compared to no treatment controls in some analyses.
Really? So, for example, mindfulness training versus another therapy that took up the same amount of time?
Virtually no difference in quitting rates found in the meta-analysis. The confidence interval for that result included 1.0.
Okay, remind us the confidence interval including 1.0 means.
It means the study couldn't confidently rule out the possibility that there's no difference between the two groups.
Right.
So we can't be sure from that data that the mindfulness training actually helped people quit more than the comparison treatment.
Okay. So for mindfulness, the studies just weren't solid enough, or maybe numerous enough to say it definitely helps you quit more than other approaches, or even doing nothing.
That's what this particular review concluded based on its analysis, yes. The evidence for these mindfulness interventions was mostly rated as low or even very low certainty.
And why such low certainty?
Various reasons mentioned in the review. Potential risk of bias in how the studies were run, that high heterogeneity, again, the studies being quite different from each other, and also imprecision.
Imprecision. Is that usually about the number of people in the studies?
Often, yeah. It means the estimate of the effect isn't very sharp. Too much wiggle room, often because there weren't enough studies or participants included in the analysis to get a precise answer. Leaves a lot of uncertainty.
Okay, so wrapping up this section for you listening, approaches like acupuncture might show some potential for short-term help based on some analyses, but with caveats. And while mindfulness techniques sound like they should help with cravings, the big reviews suggest the strong, high-certainty evidence showing they significantly boost long-term quitting rates just isn't there yet.
Right. It doesn't dismiss anyone's personal positive experience, of course, but it highlights where the current scientific evidence base stands compared to, say, the medications. It's about knowing the strength of the evidence.
Makes sense, knowing how confident the research is. Okay, so quitting is tough, but staying quit. That's often the real long-term battle, isn't it?
Oh, absolutely. Relapse is incredibly common. It's a huge challenge.
So let's look at that. What does the research say about interventions designed specifically to help people stay quit after they've already stopped smoking, relapse prevention?
Yeah, this is a critical area. We looked at a review that focused specifically on interventions for people who had already managed to quit.
Okay, what about behavioral stuff, like teaching coping skills for high-risk situations, that kind of thing? Does that help prevent relapse?
Well, for people who had quit with some initial help, the review calls them assisted abstainers. The finding was maybe a bit surprising. The review found no real worthwhile benefit from behavioral interventions specifically designed just for relapse prevention.
No benefit. That seems counterintuitive. Surely learning coping skills helps.
You'd think so, right? That's the theory. But when they pooled the evidence from the studies available, this review didn't find a clear, significant benefit for that group, the assisted abstainers. The evidence was moderate certainty, but there was that unexplained variation, heterogeneity, again, making the conclusion less firm.
What about other behavioral things, like extended support, follow-up calls?
They looked at that too, extended contact, like proactive telephone calls. Some individual studies did seem to show a benefit, but the overall analysis, again, moderate certainty, some heterogeneity, and the confidence interval crossed 1.0.
Meaning uncertainty about whether it truly helps overall.
Exactly. Couldn't be sure there was a real effect based on that pooled data. Same for extended behavioral support specifically for pregnant or postpartum ex-smokers. No significant benefit detected there either in this review.
Wow. So behavioral strategies specifically for relapse prevention in people who already had help quitting. The evidence seems kind of shaky or uncertain.
Based on this specific review, yes, that's a fair summary. Mixed or uncertain.
Okay, what about medication? Does continuing medication after you've quit help you stay quit?
Now, this showed more promise, although still a bit mixed depending on the drug. Extended treatment with varenicline, so continuing it after someone had already successfully quit.
Yeah.
That did seem to help prevent relapse. This was based on moderate certainty evidence. Still some variation between studies, but a clearer signal.
Okay, so sticking with varenicline for longer might boost your chances of staying smoke-free if you quit using it.
The evidence suggests so, yes. For those assisted abstainers, extending varenicline seems beneficial for relapse prevention.
What about extending bupropion?
For extended bupropion use after quitting, the review did not detect a significant benefit.
Oh.
The evidence was moderate certainty, but it was limited by imprecision, not enough data to be sure. So they couldn't completely rule out a benefit, but they couldn't confirm one either.
Okay, and extended NRT, continuing patches or gum after you've quit with help.
In this review, for assisted abstainers, they found no clear benefit from extending NRT use either.
Really?
Yeah, that finding was based on low certainty evidence and also limited by imprecision. But there's an important nuance here the review mentioned.
Okay.
Evidence from a different review apparently suggested that extended NRT did show a benefit for people who quit without any initial assistance, the unassisted abstainers.
Ah, that distinction seems really important. How you quit in the first place might affect whether extending NRT helps you stay quit.
It certainly seems plausible.
So the takeaway for you, the listener, on relapse prevention. Staying quit is tough, and the research on specific strategies is maybe less clear-cut than for initial quitting.
Definitely. Especially for behavioral strategies or extending NRT if you quit with help, this review found uncertain benefits. Extended varenicline looks more promising based on moderate certainty evidence.
It really highlights just how complex staying quit is, doesn't it?
It really does. Researchers are still figuring out the best ways to tackle relapse effectively.
Okay, let's pivot now to the newest challenge on the block. Quitting vaping. E-cigarettes.
Right. And this is, well, it's a completely different landscape in terms of research. It's really just beginning.
How new are we talking?
We looked at a review from early 2025, so very recent, and it's described as a living systematic review.
A living review. What does that mean?
It means the evidence is emerging so rapidly that they plan to update the review frequently as new studies come out. That term itself tells you how preliminary everything is. Conclusions are very likely to change.
Wow, okay. So we're really at the starting line here. What are the initial findings, keeping that massive caveat in mind?
The review is very clear about the very low certainty of the evidence for almost everything related to quitting vaping.
Very low certainty. Why?
Simple reasons, really. There are just very few studies published so far. The ones that exist are often small, and some have methodological weaknesses or potential biases.
Okay.
The review basically says, take these findings with a huge grain of salt. Future research is highly likely to change things.
Got it. Early signals, not firm answers. So what about medications? Did they look at things like varenicline or NRT for quitting vaping?
They did. For varenicline versus placebo, the review found no clear evidence of an effect on quitting vaping.
None.
The result was very close to no effect. The confidence interval was wide and the evidence certainty was low. So no clear signal yet that varenicline helps specifically with vaping cessation, unlike smoking.
Interesting. What about cytosine? That looked promising for smoking.
Cytosine versus placebo. Now, this may increase vaping cessation. Yeah, the analysis suggested it might make people about 1.7 times more likely to quit vaping compared to placebo. And the evidence was rated moderate certainty.
Moderate. That's higher than most things in this vaping review, right?
It is. It's one of the stronger signals so far. But it was mainly based on just one study. And the review did mention some mixed data on side effects within that study that needs clarifying.
Okay, so cytosine is maybe one to watch in this space. What about NRT for vaping? Patches, gum?
For combination NRT versus placebo, the evidence is very uncertain.
Very uncertain.
Yeah, the result hinted at a possible benefit, but it was based on very low certainty evidence from just one study with only 16 participants.
16 people.
Yeah, 16. That number alone tells you how preliminary this all is. You can't draw firm conclusions from that.
Absolutely not. Okay, what about behavioral approaches for quitting vaping? Anything there?
Text message interventions. Compared to a control group, these may increase vaping cessation rates. Specifically noted for younger people, aged 13 to 24. The evidence suggested texting made this group about 1.3 times more likely to quit vaping, but again, based on low certainty evidence.
So texts might be helpful, especially for young vapers, but we need more proof.
That's the gist of it. Early hint. Another approach, strategies focused on reducing vaping gradually, also had very uncertain evidence from just one tiny study.
And harms, side effects from trying these things to quit vaping.
Reporting was really limited across the few studies. Based on what little data they had, there wasn't clear evidence of a difference in serious side effects between active treatments and placebo. But yeah, very sparse data.
Okay, and here's a big question people ask about vaping. Did these studies track if people went back to smoking regular cigarettes after quitting vaping?
That's a crucial point. The review explicitly states that changes in combustible tobacco use after quitting vaping were not reported as an outcome in any of the included studies.
Wow, none of them. That feels like a massive gap.
It really is. We just don't have a clear picture yet from these intervention studies about whether quitting vaping leads people back to smoking or helps them stay off cigarettes if they were dual users, a key missing piece.
Definitely.
So the review basically concludes by hammering home the limitations. Very few studies, small studies, mostly low or very low certainty findings. They emphasize strongly that future, larger, better studies are desperately needed and will very likely change these initial conclusions.
And they need to track outcomes better.
Yes. Describing participants properly, did they smoke before vaping? How dependent are they? And tracking key outcomes like side effects and, crucially, whether people start or return to smoking cigarettes.
So for you, the listener, if you're trying to quit vaping,
Right.
You're kind of in the Wild West right now, scientifically speaking.
That's a fair analogy. The science is playing catch-up.
There are early hints for things like cytosine, maybe text messages for young people. But the big picture is one of high uncertainty. More research is absolutely essential.
It really underscores that our understanding of how best to quit vaping is still very much under construction.
Okay, wow. We've covered a lot of ground there. From the well-trodden path of smoking cessation meds to the brand new territory of quitting vaping research, all guided by these big systematic reviews.
Yeah, let's try to quickly recap the main points. For quitting smoking, the evidence is strongest for standard pharmacotherapies. Varenicline and combination NRT look like the most effective, followed by single NRT and bipropion. Clear benefits shown over placebo for long-term quitting.
Right. But for alternative methods for smoking like acupuncture or mindfulness, the evidence from these reviews is much less certain. Often no clear benefit shown in the pooled data, especially long-term, compared to control groups. Lower certainty overall.
Then there's relapse prevention after quitting smoking. That's a mixed bag. Behavioral stuff and extended NRT for people who quit with help. This review showed uncertain benefits. But extended varenicline did show promise for preventing relapse, based on moderate certainty evidence.
And finally, quitting vaping. The research is super new, very limited. Findings are mostly low or very low certainty. Cytosine and text messages for young people show some early potential, but we desperately need more, better research to know what really works and if it affects smoking habits.
And hopefully, this whole discussion has highlighted not just what the results are, but also the certainty behind them.
Yeah, that moderate, low, very low rating.
Exactly. It tells you how much confidence we can actually place in a finding right now and how likely it is that new studies will change the story.
Being informed about the evidence, knowing its strength, its weaknesses, where it's still evolving, that feels like a much more powerful position to be in when you're thinking about quitting.
Absolutely. And reflecting on this journey,
Mm-hmm.
it's striking how different areas of quitting research are at such different stages, isn't it? Decades of data on some things, practically starting from scratch on others, like vaping. So maybe a final thought for you, the listener, grappling with this. Given this varied landscape, strong evidence here, low certainty there, personal stories everywhere, how do you weigh these rigorous reviews against maybe your own experiences or a preference for non-drug approaches? Does this research strongly push towards medication as the primary strategy? Or are those other methods just waiting for their evidence to catch up? And for something totally new like vaping, where the evidence is so thin, how do you even begin to decide what steps to take now?
Really thought-provoking questions to end on, definitely things to mull over. Thank you for joining us on this deep dive into the evidence on quitting methods.